Okay, so IBS, otherwise known as Irritable Bowel Syndrome. This is a common disorder that affects the large intestine. The symptoms are uncomfortable, and the disorder is a chronic condition. However, IBS does not cause changes in the bowel tissue, and it does not increase the risk of colorectal cancer. It's not known exactly what causes irritable bowel syndrome. If you have IBS, the muscle contractions of peristalsis, they might be stronger and last longer than normal, which causes gas, bloating, and diarrhea, or the opposite may occur and weak intestinal contractions slow food passage and lead to hard, dry stools. Abnormalities in your GI nervous system also may play a role, which causes you to experience greater than normal discomfort when your abdomen stretches from gas or stool. You might have poorly coordinated signals between the brain and the intestines that make your body overreact to the changes that normally occur in the digestive process. And this overreaction may be what's causing the pain, the diarrhea, or the constipation. IBS is a functional disorder, meaning that the bowel functions abnormally. However, it is not a structural disorder, so there are no actual visible changes in the intestines. It is twice as common in women as in men, and about 20% of the population has IBS. And there are several different types of treatments that we'll go over in just a second. So, like I said, it is more common in women than in men, and research suggests that there might be a hormonal component to IBS, which is why we see it more in women. We know that stress is a huge contributor, and people will often have much worse symptoms when they're dealing with stressful situations. However, while stress may exacerbate the problem, it's not the cause. The role of food allergies or intolerances in IBS is not yet clearly understood, but many people have more severe symptoms when they eat certain things. A wide range of foods has been implicated, so some people are bothered by chocolate, some by spices, fats, fruits, beans, cabbage, cauliflower, broccoli, blah blah blah. So everybody's going to have their different kind of trigger foods, but in general, anything that speeds up peristalsis is going to make the disorder much worse for people who have IBS with diarrhea. So things like caffeine and alcohol should be avoided. The signs and symptoms of IBS can vary widely from person to person. IBS can either cause diarrhea, constipation, or both. So some people only have diarrhea, while some people only have constipation. But in some people, it'll swing back and forth between the two. It commonly causes cramping, abdominal pain, bloating, gas, and then either diarrhea and or constipation. Since it is a functional problem and not a structural problem, there's no specific test to diagnose IBS. Sometimes a colonoscopy and stool studies will be done to rule out other problems if there's a strong indication for it, but most often the diagnosis is just made based on clinical assessment data. Only a small number of people with IBS have severe symptoms. A lot of people can control their symptoms just by managing their diet, their lifestyle, and their stress level. But it's important that we teach patients to identify their triggers and learn to avoid them. So stress reduction and diet changes are key when it comes to living comfortably with IBS. However, there are some patients who are unable to control the disease with just diet and lifestyle changes, and there are a lot of different medications on the market that can help with IBS, but only a few that are specifically marketed for IBS. So Lotrinex and Zelnorm Those are two of the big ones. You might have seen commercials. And then other medications that might be used include antispasmodics. Those are for our patients with diarrhea, and laxatives for patients with constipation. Additionally, some antidepressants, like the TCAs, they have a major side effect of constipation, so sometimes they'll actually be prescribed in low doses to help with bowel motility.